As many of you may know, dementia is a term used to describe a decline in cognitive function, including memory, language, and problem-solving abilities. It's a challenging and often heartbreaking condition, not just for the individual with dementia, but for their caregivers as well. However, there are steps that caregivers can take to make everyday life a little easier for themselves and their loved one with dementia. In this talk, we'll be sharing some tips and strategies for supporting a loved one with dementia on a day-to-day basis. From maintaining a consistent routine to using visual cues and planning enjoyable activities, these tips can help to provide structure, stability, and support for both the individual with dementia and the caregiver. Good day everyone! We are Wellness and Love Daily, a simple podcast where we share informations, insights, and tips about daily wellness and life based on your requested topic. Today, we want to share to you about 10 tips for caring for a loved one with dementia, a practical guide for caregivers. So, without further ado, let's get started. First, maintain a consistent routine. A consistent routine can provide structure and stability for individuals with dementia, helping them to feel more secure and in control. Try to keep daily activities such as bathing, dressing, and eating at the same time each day. This can help to create a sense of familiarity and predictability, which can be especially helpful for those with more advanced dementia. It's also important to be flexible and adapt the routine as needed, as the individual's needs and abilities may change over time. Next, use visual cues. Visual cues can be a helpful tool for individuals with dementia, helping them to understand and remember daily tasks and events. This could include using a calendar to mark appointments and events, or creating a to-do list of tasks that need to be completed each day. Visual cues can be especially helpful for those with more advanced dementia, as they may have difficulty remembering verbal instructions. It's important to use clear, simple language and to place visual cues in a visible location. Third, plan enjoyable activities. Engaging in activities that the individual enjoys can provide a sense of purpose and fulfillment, and can help to maintain their cognitive and physical abilities. This could include hobbies, crafts, or social outings. It's important to consider the individual's interests and abilities when planning activities, and to involve them in the decision-making process as much as possible. It can also be helpful to do activities at the same time each day, as this can provide a sense of familiarity and predictability. Fourth, manage medications effectively. It's important to ensure that the individual with dementia is taking their medications as prescribed, as this can help to manage the symptoms of their disease and improve their quality of life. There are a variety of tools and strategies that can be used to manage medications, such as pill organizers or medication reminders. It's important to involve the individual in the process and to communicate with their healthcare team as needed. Fifth, encourage independence. Allowing the individual with dementia to do as much as possible for themselves can help to maintain their sense of autonomy and control, and can boost their self-esteem and self-worth. This may involve providing assistance only when needed and allowing the individual to complete tasks at their own pace. It's important to respect the individual's dignity and autonomy and to provide support in a way that empowers them to maintain their independence. Sixth, choose appropriate clothing. Clothing that is easy to use and appropriate for the individual's abilities and preferences can help to make dressing a less stressful and more enjoyable experience for both the individual with dementia and the caregiver. Look for clothes with easy-to-use closures such as elastic waistbands or large zipper pulls, and avoid clothing with buttons, buckles, or shoelaces, which can be difficult for the individual to manage. It's also important to consider the individual's personal style and preferences and to choose clothes that they will enjoy wearing. Seventh, use adaptive equipment. Adaptive tools and devices, such as shower chairs or grab bars, can help to make tasks such as bathing and dressing easier for the individual with dementia. Shower chairs can provide support and stability in the shower or bath, helping to prevent falls, and grab bars can provide additional support and stability when moving around the bathroom. It's important to choose high-quality, sturdy equipment that is appropriate for the individual's needs and abilities. 8th. Be gentle and respectful. Providing assistance with personal care, such as bathing and dressing, can be emotionally and physically challenging for both the individual with dementia and the caregiver. It's important to approach these tasks with patience, understanding, and respect, and to communicate clearly and calmly, using simple, straightforward language. Use a gentle touch and allow the individual to progress at their own pace. It's also important to respect the individual's dignity and autonomy and to involve them in the process as much as possible. 9th. Create a safe environment. Falls can be a serious concern for individuals with dementia, as the disease can impair balance and coordination, making it more difficult to move around safely. It's important to take steps to prevent falls and to create a safe environment for the individual. This may involve removing tripping hazards such as clutter or obstacles from the floor, and installing assistive devices such as grab bars or handrails to provide additional support and stability. It's also important to be mindful of the individual's mobility and to provide assistance as needed. 10th. Seek support. Caring for a loved one with dementia can be emotionally and physically draining, and it's important for caregivers to seek support to ensure that they have the help and resources they need. This could include seeking support from friends, family, and professional resources such as a local chapter of the Alzheimer's Association or a geriatric care manager. It's important to remember that seeking support is not a sign of weakness, but rather a way to ensure that the caregiver has the necessary support to provide the best care possible for their loved one with dementia. We hope that these tips and strategies have been helpful and that you feel more equipped to provide the best possible care for your loved one. Remember, caring for a loved one with dementia can be challenging, but it's also an opportunity to show them love, compassion, and respect, and to make a positive impact on their quality of life. Don't be afraid to seek support when you need it, whether it's from friends, family, or professional resources. And above all, be patient and kind to yourself. You are doing your best, and that is all that anyone can ask for. Thank you for watching. If you found this content helpful, please consider leaving a comment below. We'd love to hear your thoughts and experiences on caring for a loved one with dementia. If you found this content valuable, please give it a thumbs up and consider sharing it with others who may benefit from this information. And if you'd like to stay up to date with our latest podcast, don't forget to hit the subscribe button. Thanks again for watching. See you on the next content.